All right, this week on Medicine 3.0, your podcast for AI in medicine, precision medicine, I've got Dr. Michael Curren from UPMC, and he is a cardiologist and an informaticist. If you don't know what an informaticist is, you're going to learn. That's basically a physician who knows how to use technology to make healthcare better. Michael is so mission driven. This was a wonderful conversation. I think you're really going to enjoy it. All right, Mike, welcome to the podcast.
Well, thanks for having me. This is my podcast debut. Very excited about it.
So this will absolutely be the best podcast you've ever done.
Clearly, yeah, exactly. Yeah.
Awesome. Well, I want to start with you telling us how you got where you're at, knowing what you know.
Sure. Well, not to tell you my whole life story. I grew up in a small town in northwestern Pennsylvania called Warren, Pennsylvania, middle of the woods. Blue collar, with hardworking parents who taught me the value of doing that. And I've had a job of some type since I think I was about 12. And, that really instilled in me just what I could contribute to the world. And I really was drawn to medicine. At a young age, my grandfather was a family physician up in that town. And, I would walk around, your grandfather delivered me. He did this, he did that. He took off this mole. And I realized the impact that a person could have on other people in a community just by providing care to them. And it was fascinating to me. It's what drove me to medicine, which you got to work hard to get here, right? Anybody who's been through it knows that the work effort that we have to put in to go through undergraduate and medical school and training. And I'm a non-invasive cardiologist, so I spent an additional 3 years of training after all of that to get here. And then I decided that there's more to delivering care on an individual level than just delivering care on an individual level, where you could impact a lot more people in this thing called the electronic health record and IT, or whatever you want to call it. And it just really interested me to try to have a bigger impact. I have my stethoscope around my neck because I'm seeing patients today. I still see patients and I love it. I get great joy out of that. But I also realize that there's a lot more opportunity to impact more people in a increasingly meaningful way. And that's how I'm here.
I love that arc of, it sounds like you had a little bit of medicine in your family with your grandfather as a physician, and kind of hearing those stories. Was there ever a time when you were going through your training, like at what age did you decide, I want to be a physician? And then I'm curious, like, how did you decide, like, I want to be a cardiologist?
Yeah. Well, I was going to be a pediatrician because that just seemed like a great thing to do. And that was, fairly early on. Before I went to college, I went in with a biology or pre-med degree. And I realized as I got started in medical school that babies weren't for me. And like everybody, I don't know if you decided early on that you wanted to do emergency medicine, but you evolve, right, as you get exposed. And my mind is fairly mathematical, and cardiology is a lot of math and plumbing and physics, and it just made sense to me, and I enjoyed the disease processes. I enjoyed the broad aspect of it. This actually as we talked through this, it's actually applied a lot to my world in informatics. I do a little bit of everything as a non-invasive cardiologist. I'm a primary care doctor. I take care of patients with heart failure chronically, and I manage a lot of their struggles with that. I'm an imager, right? I read images. I'm kind of a radiologist. I do some fairly basic procedures, but I spend time having to schedule patients and manage them. They have complications. And I'm a consultant. I work in an ambulatory space. I work in a hospital. So I've realized I really enjoy every aspect of the care that I deliver, and it's a unique specialty to be in, to be able to do all of those things. And I kind of figured that out throughout medical school, that I liked all of those things that were offered in the world of cardiology.
Yeah, it's interesting, the overlap between kind of a generalist in almost any specialty, the ability to learn all these different things. And I think it also gives you a nice breadth as you tackle kind of working in the informatics space. And I want you to kind of help us understand, you spoke to this. You said working in informatics allows you to impact more than just the patient in front of you. Help people understand what that means. Like, what can you impact as an informaticist?
Oh, what can't you impact? Right. I think so. Let's use the example of trying to drive improvement in preventative care. Immunizations is a great example, right? And you start to realize if you have an area where we've struggled delivering an immunization to a selection of people, you start to look at the workflow of how that's delivered. You talk to the clinic and they say, this is how we do this. And this is our population of people and what's challenging to them to get to wherever they need to get to. And then you talk to the physicians who are part of it and the nursing staff. And then you look at potentially what is built out in the IT system to prompt or to document or to send to a patient as a reminder. And you can find gaps there and close those gaps. And so it's not just about the person in the office saying, hey, did you get your flu shot this year? It's a saying to the population of people first in that clinic, and then potentially in all of the areas that are delivering flu shots to close the gaps that you've identified to make that a better delivery of care to those people. And there's countless examples of how to do that, whether it be in a hospital space or in an ambulatory space. It's just incredible. I mean, it's limitless. It really is, Jared, and that's what makes it so humbling when you try to do this work to improve care for patients. It really is. It's really great, particularly when you get the good stories of what you've done. When you see either the data that comes out on the other side, or you see a patient who's benefited from that, and they might not even know that you had anything to do with what they've benefited from. But it's a very gratifying and humbling thing to experience.
Yeah, I think it's sometimes difficult for people to understand that you just named several different processes that are technology, but then human is all as well. And that's where healthcare starts to get so complicated. And we know that healthcare, even depending on where somebody lives, makes a difference, or what their experience is in life, and then how they deal with that technology. And then when they meet the nurse who's has the technology, or the physician who has the technology, or the office staff who has the technology. And so I'm curious, when you're working on something like that, are those decisions that you kind of make in a silo, or how do you come up with these like initiatives? How do you work through this?
Great question. So a couple of different ways. Somebody might come to us with a problem, right? And they've recognized that they are missing an opportunity to deliver care, or something is amiss. Or alternatively, we may identify that proactively. Sometimes it's through just experience. Sometimes it's through being approached by someone external to healthcare, a technology vendor. They may say, hey, we think we might notice something here. And always, be aware of listening and assessing what is being brought in front of you. And then it becomes a partnership with whomever you're working with that usually includes a clinical caregiver. It should include a clinical caregiver, right? It has to, because we understand the workflows of what we're doing, and they potentially identify some of the barriers there. Sometimes we can be too barrier driven and say, well, that's never going to work. And that's one of the downsides of physicians who try to solve problems sometimes is we say, oh, that'll never work because of X, Y, and Z. And so we try to say, well, let's think about this, right? And those docs or nurses who are forward thinking often can overcome that. We also partner a lot with people in our IT space, right? So our colleagues who manage applications or manage networks or whatever that is, to work with them to say, hey, what are our opportunities? What can we potentially modify to solve this particular problem? We have to understand the limits of whatever system it is that we're working in to be able to build a bridge between our patients, our clinical users, and our applications that we're working with to come up with the workflow that makes the most sense to be able to deliver the care or solve the problem that we've been asked to solve.
I think it's helpful for people to understand the complexities, because lots of times working in healthcare, we hear how bad healthcare is from the outside. We'll hear people tell us that we're not doing a good job. And I think it's so important for people to understand the complexities of the system. How do you think, if you were to kind of guide somebody who is trying to innovate in healthcare, and they want to understand the complexities. I mean, you spoke to some of these complexities already. You've got the caregiver, you've got the IT infrastructure, you've got all sorts of governance in the hospital, you've got regulations at the federal, state, all the way down to the hospital level. You've got all these different things. If somebody who is wanting to learn about like how to innovate in healthcare, where would you kind of point them and say, this is where I would start to learn?
Well, first, I just want to respond no one goes into healthcare wanting to do a bad job, right? Nobody says,
Exactly.
I want to do a bad job. Everybody wants to do a good job. They want to
Yep.
help people. We don't go into this profession to be mediocre. Um,
Yep.
and I think that's a good frame of guidance, right? When someone is looking for these things, you should be asking them the questions of, what are you seeing, right? What do you think um, will help you to do that great job? Um, and just ask why. Why is something like this? Why do we do it this way? Sometimes there may be an answer of, well, there's a federal regulation that requires us to meet certain things, and therefore we must do it. And we all hate hearing that answer, but it's the reality of the health system that we work in. So then you start to ask questions of, is there a better way to deliver whatever that requirement is? And so it's really, the guidance is just be curious and ask the questions, and push when you ask those questions. That's how I got into this role, is I asked questions. And actually, just to take a brief aside, I was a fellow in cardiology many years ago, and I was asked to participate in what I thought was a focus group about just doing some basic, EHR work, right? And it's still fairly early on in meaningful use, box checking, right? And trying to do all of the requirements that the federal government put in front of us. And I went and I complained and I asked questions. And I did that a couple of times, and it led to an opportunity. And that opportunity has led to now a career in informatics that I never anticipated when I started as an intern in 2013. And that is really what I encourage anyone who's interested in this field to do, is ask the questions, take the opportunities, particularly early on, and never say no to an opportunity to either ask a question or participate in a content review session, because you learn about all of sometimes the ridiculousness of what comes out in the healthcare space because of how we've transitioned over the years. And it's an opportunity to then input and make changes to be a better doctor and to deliver care to your patients. And I also approach this as, when I give advice to people, don't think about you, don't think about where you work for, think about how you can care for the patient. I frame every conversation when I'm talking to doctors about the impact that it has on the patients, how you can provide better care for your patients. I think that also sometimes removes the friction that just is natural to come up when we are implementing technology changes or workflow changes, whatever the change is. If you remind people what we're here to do, it makes it's level setting, right? Because we all want to, back to what you said, we all want to do a good job.
Yeah. Mike, I love that guiding light. Put the patient first. It's about the patient. And I'll just reiterate what you said, that, it is such a privilege to be a physician, but it is such a responsibility. And everybody who does it, every nurse, everybody that goes into healthcare did it because they felt, some sort of, I always say some sort of calling, but whatever that is. And so I think that's what's so exciting also, is to have a true mission, and that mission is deliver better care. And so when you think about that mission today, we're in this kind of exponential growth of technology space, and it's just seems like it's exploding. And at times it can seem overwhelming. You'll hear doctors say like, oh, am I going to be replaced? Is AI going to take my job? And I think for you and I, who understand healthcare pretty deeply, we're not very worried about that. But I'm curious, what are you seeing that gets you really excited about the movement of technology? And then I'll follow up probably with like what scares you about the movement of technology.
Yeah, sure.
But let's start with what's making you excited.
What's making me excited is the the speed of solutions, that meaningful solutions, um, it's really, really hard for patients to navigate the healthcare system, right? Um, Whether it's getting into an appointment or getting into a result or talking with someone, and the development of tools to just break down that access barrier, right?
Mm,
Whether that be they are scheduling themselves through their patient portal. I mean, who would ever thought that could happen, right?
right.
It's crazy to me that how quickly those and that continues to evolve, right? It's breaking down that barrier for the patient to get what they need, and also to be even more invested in their health. I'm a cardiologist, and so the concept of wearable data from patients is very real to me.
Yeah.
I've made diagnoses on patients' Apple Watches that they've bought for themselves because they were worried about something, or their family member bought it for them, and then they send me their EKG that comes out of an Apple Watch that they wear and say, "Hey, this told me there was something wrong," right? That's preventing a stroke 5, 10 years down the road when you make that atrial fibrillation diagnosis. That is incredibly exciting. I think that the concept of reliable medical grade diagnostic tools that a patient can bring to you, right?
Mm,
And
yeah.
bring it to you and with a barrier that is as simple as, connecting it to their portal and sending me the message, as opposed to, well, I'll wait till I see them in 3 months. And a lot can happen in that 3 month period of time when they have something, right? That's so exciting to me. I could go on and on about this, but I will. I'll stop at that one, and we can keep talking about other opportunities and fear.
Yeah. I have actually just a pointed question about the wearables thing. I have a good friend who's the CEO of Validic,
Mm-hmm.
and they do wearable integrations into EHRs. And I was talking to him about it recently, and he was just kind of bemoaning that like there isn't as much adoption as you would think.
Mm-hmm.
And I'm curious what you think the blocker is there.
Um, I think it's still relatively early, right? I think one of the fears, several fears there. It's validity of the data, right? How do you know it's coming from that person, and you're going to make a decision based on that? And I think we'll overcome all of those things. I think it's comfort of the provider of understanding what they're receiving. Um, Also, there's a fear of an inundation of data,
Yeah.
right? What am I going to do? How can I ever manage if all of my patients are sending me their heart rate and their blood pressure and their in some structured format? I'm never going to survive. I'm already buried in my inbox, right?
Yep.
But I think this is another very exciting area as we have tools that will compile that data for us. I promised myself I wouldn't say AI in this talk, but it's impossible not to, right?
Yeah.
Because it's there. And so when you can take these huge data sets, which these essentially will become, right, as
Hmm.
patients are sending you this structured data, you'll have tools available. We already have them to summarize information for us, right? And then to present it to me, as opposed to me having to dig through and making a decision on that. That's a very real thing, right? I mean, I've seen it firsthand. That is incredibly exciting to me, and incredibly empowering for any provider to be able to, again, this goes back to taking care of patients, right? To make it easier, to break down that barrier of making good informed decisions.
Yeah, I agree with you on the data problem is, as physicians, the more and more data comes and you have less and less time to like analyze the data, act on the data with your patient, just because of all that's asked of a physician. And so I think those tools are just so exciting to start thinking about, being able to be alerted when something is actually important and it going to the right caregiver. Maybe it doesn't have to go to a physician. Maybe it just needs to go to a nurse at a
Mm-hmm.
certain point and then to a physician at another point, and being able to take action on that. I think that's incredibly exciting. And when I think about, the use of artificial intelligence, and we say that term, and this like I do, that is a big umbrella term that covers so many different things. But when I think about this exciting moment that we're entering, where it's becoming really practically useful, and of course, you and I both know the space of kind of the AI scribing with Dragon Ambient
Mm-hmm.
Experience or Abridge or Suki or Nabla or all the others that exist out there. I'm curious what you see as like the next step. What do you think is the next step after, one of these And for those who don't know, this is something that, records a doctor-patient conversation, writes the note for the doctor. But what do you think is the next step in an AI assistant helping a clinician in take care of a patient? So we talked about data analysis. What are some other things you think?
Um, I think the most practical next steps that we are already starting to see is for that assistant to not just react to what you've put into it, but prompt up data accumulation, right? Whether to be able to scan records, whatever those are, and I can ask a question, right?
Yeah.
And say, hey, can you show me a trend line of this value, right? And it shows it to me, right?
Yeah.
Or it says to me, and I'll just use some heart failure examples. It's easiest to use examples in your clinical practice, right?
Yeah.
Hey, Mike, I noticed that this patient's ejection fraction has decreased over the past 5 years. Here's all of the source data behind that. Here is a guideline related to that. Here's therapies related to that you are doing and that you should consider, and allow me to, without having to go and actively review that, which is what I have to do now, it is there in a interactive way. We have clinical decision support now, right? Where I'll get that patient has this. Do you want to do this? That's not what I'm talking about, right? This is interactive assessment of information that virtual assistant will be able to do for us. Other very simple things, tasks, right? Do this task for me, order this, send this note, whatever you ask it to do. It is exciting. It actually scares me a little bit, just from all of the things that it can do.
Yeah.
But there's no question that this will be part of delivering healthcare in the very near future. It's here and it's real, and it's incredibly helpful to someone who is trying to navigate through the ever increasing complexities of delivering care to patients.
Yeah. I think, the low hanging fruit is going to be administrative tasks and things we don't want to spend our time on anyways. It's interesting because then the question becomes, are those administrative tasks like even important enough if a computer could just do them completely for us? But it's not like
different question, right?
yeah, exactly. We don't usually cut things out. We mostly just add things.
Yeah.
But the other thing that I think is extremely exciting is the idea of, and I really think it's going to sit in the hands of informaticists to enable their health systems and their physicians with the tools they need. Because I kind of think of this, and I don't know if it will actually progress like this, but I love the co-pilot idea. Like, I love the idea of you as an informaticist being able to define your own problems that you want to solve, build your own co-pilot for it, and automate that process and make it so that this happens for this pool of clinicians that need this tool, and it just happens automatically, and you don't have to always wait for a vendor to come bring you a solution, but you can just make your own solutions.
Yeah, I completely agree with you. I think that the opportunity to do that is there, right? And you talked a little bit about the role of informaticists. I don't think people understand, number one, what informaticists do many times, which is one of the reasons why we're talking today, right? But it really is critical to be able to understand both technology and delivery of care. And how to bring those two things together. That's a very unique skill. If you haven't been at a bedside as a nurse caring for a patient, you don't understand what that's like. And people who are able to bridge that world of technology applications in clinical care delivery bring incredible value to both healthcare organizations and industry to be able to understand that. And I think organizations that have realized that are clearly making bigger strides delivering care in our world that we live in than those who are a little behind there. And I think it's a real opportunity for anyone who actually is interested in solving these problems to think about in their future.
I think it's such a timely. I don't know if you paid attention to the company called Forward. That just went bankrupt yesterday, but they believed, and I think they had a great mission. They wanted to rethink medicine
Mhm.
from kind of from first principles. And I understand that belief that you could do that. But I think, as you stated, the understanding of what it's like to give care, the complexities in giving care, the complexities in humans, understanding that system, and then bringing in the understanding of technology is so key. And I've seen this honestly just working on the tech business side of
Mhm.
things. Usually a product manager has to go out and talk to a subject matter expert
Mhm.
and another subject matter expert and try to bring together insights and then build a product feature. But what if a physician who knows it is that product manager and can throw that together? And so I think that's what's so powerful about being a clinician informaticist. I really love
Yeah,
that.
it's. I mean, it's the modern the analogy, not the analogy, just the comparison that I give. Like, the stethoscope was invented by a French musician physician who understood sound characteristics. He made his own flutes, and in doing so, he said, "There's got to be a better way than putting my ear against the chest."
Right.
Which, by the way, in the early 1800s, when this was invented, it was taboo. You couldn't put your ear against the chest in a woman if you were a man because it was considered inappropriate. And so half of your patients, you couldn't even do this ineffective thing. So he created the stethoscope, right? He had a skill set that he understood, in his musicianship ability and his making of instruments, and said, I just going to carve a tube and listen that way. And now we have a tool that you can't imagine working without a stethoscope, as an emergency medicine physician. The same thing, it's the same principle applies to the world of informatics. It's applying knowledge that you have in a technology space to the care delivery that you're trying to do. I think that that's a great way to think about the evolution of the importance of physicians in driving innovation in tools. It goes back to the invention of the stethoscope and everything else before that.
Yeah, that is such a great example. I love that example. When you think of, so we touched on our hopes. Any fears over the next, 2, 5, 10 years?
Um, I mean, it is not. It is the fear of, I think, healthcare in general. The security that comes with healthcare is even more important, right, than security of your home network. When I'm talking about security, I'm talking about IT security, right?
Yeah.
Accessing data. I think it scares a lot of people. I mean, we see the ransomware attacks on health systems, right, and the money associated that people are demanding, and in time, in examples of them paying, right, of hospitals paying because they recognize the criticality of their system. But that is fearful, right? I think
Yeah.
that is fearful for a lot of the system. I believe that the biggest threats to any healthcare delivery system is access to their network, either whether it be some type of a virus that gets on the network or stealing of very sensitive data, right? And
Yeah.
I think that'll be an ongoing fear. That is not a fear that will ever go away in the world that we live in. Um, from a more personal level, I'm not fearful of technology taking my job or really any clinical person's job. I think there will be things that will be replaced by technology, but will allow for people to apply their skill sets on a higher level, and focus on more complicated clinical processes. So, I don't have a lot of personal what we in healthcare, how we deliver care. I don't think any of us really truly do. Some of the fear of, well, radiologists will become obsolete. That won't happen. They will be augmented by technology to help them make better, faster diagnoses on those simpler normal exams, so they can focus on the more complex processes and get assistance in doing so. So that my fear is I think a lot of people in any technology space, it's security of our data and keeping that safe so that we can keep delivering better care.
Yeah. Yeah. And I think that I love how you finish that sentence, so we can deliver better care. And
Yeah.
I think that's exactly what it comes back to. So, Mike, this has been an amazing conversation.
Yeah.
Thank you so much. Anything you want to leave the audience with?
I think I'll just go back to my theme. If you focus on what we are trying to do, which is create better health for people, whether they are healthy and they want to remain healthy, or if they are sick and want to get healthy again, and as you are applying whatever effort you are applying, whether it be an IT project or something completely different than that, how you're changing the menu in a hospital. You have to focus on the patient. If you lose focus of that, I think you lose focus on your mission of being a care delivery provider. This is an incredible privilege to be a physician. I can't tell people that enough. It's not an easy task, but we have to remain focused on what we are trying to do. And if you do that, you will have failures along the way, and that's okay, right? But it will continue to drive your goals and mission forward to make a healthier population for people to enjoy life and be healthy members of society. Jared, I appreciate this. This has been great.
Oh, thanks, Mike. This was great and well said. And yeah, I'm sure we'll have many more fruitful conversations over our careers.
Yeah.
So
looking forward to coming back. Yeah.
Yeah. Awesome.
Thank you.
Thank you for listening to another episode of Medicine 3.0. We make this podcast so that you know where to turn for good information on keeping you and your loved ones healthy. Feel free to check us out at bionichealth.com, where we can help you live a longer, happier life.